In Uganda, heart disease, cancer, chronic respiratory disease, and diabetes kill up to 100,000 people annually, up to 33% of the total annual deaths in the country. Non-communicable diseases are those that are not transmitted by another person, vector, or from the environment. Obesity, tobacco use, poor nutrition, and high blood pressure stand out as major risk factors fueling the NCD crisis in Uganda. Globally, 7 of the 10 leading causes of deaths in 2019 were non-communicable diseases, 44% of all deaths. Non-communicable diseases together accounted for 74% of deaths globally in 2019.
NCD burden is very high worldwide and also in Uganda. And about 40% of deaths that were recorded was attributed mainly to non-communicable diseases. And of these, 4 major non-communicable diseases, that is cancer, diabetes, cardiovascular diseases, and chronic obstructive respiratory diseases, accounted for up to 33% of the death.
In Uganda, with over 75% of the population below the age of 30, NCDs exert a huge burden both on the individual and on the economy.
The most productive population, that is between 30 to 49, is actually second in terms of loss of productivity. And the main reason is because of ill health, our lifestyles. The repercussions from that is most of the diseases we get, including actual obesity, are mostly non-communicable diseases. And these are diseases that actually are preventable if you are able to pay extra attention.
Many young people are losing a lot of their hard-earned income to the treatment of non-communicable diseases.
You have to buy test strips. You have packets of syringes, insulin vials. Those cost about 30 to 25,000, and then the hospital consultations, tests done to just make sure you're functioning okay, your organs are okay. Roughly 500,000 a month, I would say. That's the only way you're going to live for the rest of your life.
Cancer accounted for 37.9% of NCD premature deaths in 2016. In 2020, as the world was being ravaged by the COVID-19 pandemic, Uganda recorded over 34,000 new cases and over 22,000 deaths. But what really is cancer?
So cancer is a very serious disease. Basically, it is cells that just run amok, they run mad, cells of the body which are operating normally. They start growing very uncontrollably, and then they invade tissues in the body. If they find a bone, they invade the bone, they destroy the bone, they can destroy a blood vessel, they can destroy the lung. Basically, they're very aggressive cells. We used to see what we call Burkitt's lymphoma, which is a cancer that grows in the lymph nodes. That used to be the commonest. Recently, that has changed. We now have leukemias as the commonest cancer among children. Now, when we go to men, it's a different thing. It's now prostate cancer, which is common. And among women, it is definitely cervical cancer, which is the commonest cancer.
Budde bwali bwa kiro agenda okulanga nvaamu amazzi agatali matuufu. Kyonna ye ne ntya nnyo. Natuuka mu ddwaliro ne nnyonnyola omusawo ekyantuuseeko. Omusawo n'aga nti akatukole test tulabe, ne bansindika mu laabu. Bwe bankebera bo ne bakonfamingirawo nti kansa.
According to the World Health Organization, between 30 and 50% of cancers can be prevented by reducing risk factors and implementing evidence-based prevention strategies. Many cancers have a high chance of cure if diagnosed early and treated appropriately.
Biri 18 n'eŋŋenda e Mulago. N'ab'e Mulago mbeebaza bankolako bulungi nnyo kubanga sina kye natawaanyizibwa. Ne ntandika obujjanjabi. Obujjanjabi bwe nasookerako bwali bwa kemo. Naye mbadde ŋŋenda e Mulago buli appointment gye bampa.
Hypertension in Shirudi is very common, and yet hypertension per se contributes to all the others of the different cardiovascular diseases. Cardiovascular disease basically means diseases that affect the heart, and under this we can have diseases that affect the valves of the heart, the muscles of the heart, the chambers of the heart, the flow of electrical activity within the heart, and then still the blood vessels that supply the heart.
In the 3 years from 2013 to 2015, diabetes cases registered in outpatient departments increased by 7% from 30,000 to 32,000 according to Health Management Information System surveillance.
Personally, I was shocked to the point I had no word. The doctor said, you're not having sugar anymore. You're not having any sugary products anymore. You have, she said it in Luganda, oina sukari.
So some of the risk factors that are contributing to the increase in these numbers, the increasing life expectancy, because some of these diseases like the cardiovascular diseases and renal diseases can come with age. So the increasing age, Ugandans are living much longer than before, okay? 62 to 65 years. The other thing is the sedentary lifestyle, lack of exercises, and other things are associated with obesity. We know that obesity has a number of factors, development of diabetes, hypertension, and later on cancer. So we're seeing more people becoming obese as a result of not exercising. The pollution, it's very important and it's a risk factor that we have to work on. I'm happy that the government is working on reducing the number of vehicles that come in that are very old. You can have liver diseases, you can have heart diseases, you can get strokes, okay, from smoking and alcohol. Of course, if taken in a very high quantities, can be detrimental.
As the statistics continue to show an upward trend, many misconceptions are being challenged.
Before, we knew that NCDs were diseases for the rich or for the affluent countries. But now we are experiencing them even in the rural communities. We're moving away from our healthy indigenous diets and we're moving to fast foods that are characterized by high sugar, high fat, low fiber, mainly because of the kind of work that we do and convenience and even advertising. So there are very many reasons.
Every time we fry food and we take excess oils, all those have an impact on the liver, on the body. So we encourage people to eat less margarine, less fat, less oils, because that way it will help them to keep healthy.
Government encourages adherence to treatment as one of those things we need to focus on at an individual level to reduce the prevalence of non-communicable diseases.
We are very poor health seekers as Africans. We usually seek help only when we are really down.
There are many Ugandans who are doing shortcuts. They have a condition, but they just walk in a drug shop or a pharmacy. And so you need to walk in and go and see a doctor when you have a condition. Some cancers can be cured. But the bottom line about cancer is how early do you come to seek care?
Government, in its efforts to manage the NCD burden, has invested in the national health infrastructure at all levels and also manpower to reach the Ugandans at the last mile. In a bid to support people in communities, regional referral hospitals are bridging the health service delivery gap to reduce the prevalence of these diseases.
Largely, most of these NCDs are managed in the regional referral hospitals and in general hospitals. On a policy level, we think that prevention is better than cure, because we know that once you do checkup early and you detect the illness early and that illness is treated, there is a higher chance that you prevent it from getting more complicated, and therefore even the expense of treatment will be manageable. But also some can be treated and you get cure.
Nsiima nnyo byonna naye nga kyensinga okuwa kwekebeza. Bwekebeza nga bukyali ofuna obuyambi ate kyensuubira obulwadde buwona bwe bakolako nga bukyali.
Uganda initiated a national HPV vaccination program for the prevention of cervical cancer, and the campaign is currently ongoing.
In terms of investment, in terms of our health system structure, our first contact at a village level, these are our village health teams. And as government, we have revitalized this structure in terms of focus for them to know that beyond the communicable diseases that we are grappling with, we also have the non-communicable diseases. So in terms of orientation, in terms of training, for them to be able to know and to get basic information which they can actually from time to time be able to pass it over to members of the communities.
Naye kati ndi wa mukisa kubanga byabasawo bibanjigiriza nembiraba nga ddala bikola amakulu era bye bituyamba okubeera abalamu, okubiyiga okubirima n'okubiyiga okubiteekateeka n'okubiyiga okubirya. Nange kati awaka wange bifuuse kitundu ku bulamu bwabwe. Ekyo kituyambye okulabika nti abaana endwadde zikendeera ate ne ssente ne zisigala nga mu nsawo mweziri.
We do believe that more people will pick up that culture of general checkup, routine checkup, and that will avert so many complications.
We definitely encourage people to have annual checkups from time to time to ensure that you know what is affecting you, to know how you can go about it, but of course also to know when you can actually seek healthcare services.
At an individual level, the NCD crisis should challenge every individual to consciously consider their lifestyle choices and be driven to a culture of regular health checks.